Good morning, everybody. Good morning. Welcome back to my YouTube channel. Not my, it's your YouTube channel where we discuss our life of a nurse in the UK. What's their salary? How they prepare for their exam? How do they get their NMC pin? These are all the things we discuss here. Today's video is a bit special. We are going to discuss the responsibility, the duties of a nurse, what they do throughout the day, how many hours they need to work per week, and how many annual leaves do they get. So let's start the video. So in my previous video, we talked about my salary. We talked about the nurse's salary in the UK before getting their NMC pin and after getting their NMC pin. So if you haven't watched that video, go back and watch the video. It's quite helpful to know how much do you earn after passing your OET or IELTS, after passing CBT, Osce, how much do you earn. Okay, make sure you remember to watch the video. Alright guys, so today we are going to talk about how many hours do we need to work. So if it depends on your trust, but most of the times you need to work 3 or 4 days in a week. We need to complete 37.5 hours, which makes it like 3 days in a week, and the following week it's 4 days. So you work 3 days in a week, and in the following week you work 4 days a week. So which makes it 37.5 hours per week. It's not bad. So what I do, I usually take, I work for 1 day. It's 12.5 hours a shift, but we don't get paid for our break. You have 1 hour break in this 12.5 hours, so you will be paid for 11.5 hours. It will be calculated as 11.5 hours per day. That's a long day shift. So you do 3 long days, right? So 3 long days, and then it's 11.5. Breaks are not included. And also for your annual leave, you get 262.5 hours for your annual leave. That's your annual leave for the whole year. Year starts here from April till March. So this April is the first month of the year in the NHS. So this is the first month of the year. The tax are renewed. This year they did not renew the tax code. It's the same, but last year they did. They changed the tax code. You get new tax code for 2022. You'll get another one for 2023. So April is the year. April is the month where they start from the beginning. They consider as is the first month of the year. If we say about annual leave is 7.5 weeks, 7 weeks and a half, which is quite good. Whether when you work in the agency, or if you work with the bank partners instead of working permanent with the NHS. So when you start working with the NHS, is a contract for three years, but it's considered as a permanent. Like after finishing your contract, you can renew it. So it's considered as your permanent contract with the NHS. But if you work with the agency, or if you work as bank partners instead of working permanent job, you're not gonna get these benefits. You're not entitled for your annual leave. You're not entitled for sick leave. It's just like if you don't go to work, you don't earn, right? So these are the things you need to consider. If you are on if you are sick, if you are on sick leave, you are get paid by the NHS, because everybody gets sick and it's not their fault, right? They are not taking off for their own purpose or anything. So if they are sick, you get paid by the NHS. And it's quite good, because if you work with the agency, you're not gonna get paid for that. And what else? The pension is included. You'll get pension at the end of your retirement. It's after 60 years, but I heard they are going to make it 70 years. Let's see, but for now it's the age limit is 65 years. You work for 65 years, like at the age of 65. So you're retired at the age of 65. Like I started in NHS when I was 25 years old. So it's now 1.5 years. So I will retire by the age of 65, then my pension would start. But every month, whatever you earn, your pension is deducted. Most of the times it's like the more you earn, the more pension is deducted. So tax is deducted, pension, and your national insurance, 3 things. And if you want to opt out from the pension, you can do that. So for our trust, there is a policy like within 2 years of joining, you can opt out if you want to. If you don't want to pay for your pension, it's your right. You can consider opting out. You just need to submit your form and opting out pension form from for the to the HR. After doing that, your name will be deducted from the pension scheme. Bank partners, where you do extra shifts within your trust, that's called bank partners. You can opt out from the pension if you don't want to pay pension, because sometimes people have different plans. Maybe they want to move out or they want to go back to their country and they don't want to pay for the pension. You can always opt out from the pension, because it's a lot of money. Like for the pension, if you're not gonna stay here, what's the point of paying pension each month? So if you don't want to stay here for long, if you want to move somewhere else, I think it's good just to opt out. But if your plan is to stay here permanently, to stay here with your family, then it's good, pay for your pension. Also, GP and NHS health services is free, but with your job you get to see you get the chance that you can be seen by the occupational therapist if you need any support from the occupational therapist. If there are changes that you want, that you cannot work that hard, or you feel like let's let me give an example. I was off sick with COVID. I still have breathlessness and tiredness, so I requested my manager to give me some work in the lighter department, in the where they have less patients. So my manager would refer me to the occupational therapist, and then they can make changes to my workplace. So that's the benefit also you get when you work here in the NHS. They are quite good, in terms of your health and your safety, whether it's safe for you to work in this setting, whether it's safe for you. Can you manage? Do you have strengths? Are you physically fit 100% to work in this area, in this particular area? So I quite like that. If you feel like you're having trouble working in a certain department, you can always go back to your manager and talk to them. So we have discussed about sick leave, annual leave, occupational therapist, GP, and all those things. You also have emergency leave. If you have any kind of emergency back home or anything, you can ask your manager for the emergency leave. And also you have unpaid leave as well. But of course you need to discuss with HR and your manager first. If you want to take time off, if you want to take some time away from work and you don't want to be paid, you can do it, but you need to speak to the manager first. So all the benefits of working in the NHS we have discussed. If you have any question, please don't hesitate to ask me. One more thing, you get maternity leave. For you are paid for 6 months, but after that it's half salary. But I'll make another video in detail I'll make another video in detail about maternity leave and its benefits in detail, because it's quite a long procedure to understand, and you also need approval from your HR. If you're pregnant, you need to inform your manager and your HR. Then they send you all the paperwork. You go through those paperworks and you decide whether you want to take off leave. You can take leave up to 1 year. It's up to you, but there are certain times, like for 6 months they paid, and after that there is a different kind of way. So I'll make another video on that one. Now let's talk about the duties of a nurse at work, what we do, and what kind of things we need to do. Okay, as you all know, as a nurse, what is our job? I will go through the whole procedure. Let's say it's my long day today, how I would start my shift, what are the things I need to do, and before the handover, what are the tasks that I need to finish. So most of the days, like all the time, we start with the handover. As you all know, we start with the handover. We start the shift at 7:30, at sharp 7:30, starting with the handover. That's a big handover of all the ward, and everybody is there. Your supervisors are there, managers are there, and all of your colleagues are there for this handover. After the handover, after the big handover, you go into your team. Whichever team you're assigned to, you go into your team. You take the handover from the previous nurse and the support worker. You get your handover, and then you say goodbye to them. After that, the first thing we do is I just like to go through my vital pack, where we record all the information of the patient, all the vital observations of the patient, their temperature, pulse, respiration, everything, all the OBs are there. So I like to go through first of all on the vital pack. I want to see if my patients are not scoring high, if they are all good, if there is anything outstanding I need to do, if there are any OBs pending that I need to do. First of all, I like to see that one. So after checking the OBs, just on the system, everything is all right. If nothing is due, I'm happy to start the medicine, the drug round for 8 o'clock. We start the drug round right at 8 o'clock, and in the meantime breakfast comes for the patient. So I have a sport worker with me who would help me with the patients, who would help me to serve the breakfast to the patient. If someone needs assistance, if someone is on red tray, if needs assistance, she would help me to feed those patients. So I am starting the drug round for 8 o'clock. I'll start the drug round. She would help me with the breakfast. So if I have 10 patients, usually you get 10 patients, but there are also times when you get 11 or 12 patients, depends on the department and acuity of the patient. If the patients are medically fit, if they are well, then you will get like 12 patients. But if you work in ICU or ITU, there are chances where you get one patient or two patients. So it's always depend on the on the acuity of the patient. So here I work in a medical department, so we would get 9 patients or 10 patients or 11 patients, that's the maximum, and one nurse and one support worker for those 10 patients. So I started the drug round at 8 o'clock. If I have 10 patients, I would finish at 9:30, or sometimes if you have loads of drugs, it will go to 10 o'clock. And in this time you also need to give, if there are controlled medicine, if you have blood sugars and insulin. Sometimes if they did not check the blood sugar in the previous shift, so you have to do the blood sugars and give your insulin for the patient who are due for the insulin within this time frame. Don't forget your insulins, guys, with the drug round. Now it's already, I would say it's 10 o'clock. My sport worker has finished with the with feeding the patients. Now we both are free. We can wash our patients. So every day we provide personal hygiene to the patient, mouth care, oral hygiene, and skin. We give bed bath to the patient who are not able to do by themselves. And if they are independent and mobile, well and good, they can go to the toilet and then they can do everything by themselves. If they need help, we are there to help them. At this time, after doing the drug, we do the washes. So we will finish maybe around 11 or 11:30. That's the time when you do your blood sugars. If you have diabetic patient, you do the blood sugars, and then I would say it's 12, then you start the drug round again. Patient gets their meal, that's the lunch time, around 12:30. So they get their meal, you do the drug round for 12 o'clock. And if you have 10 patients, it's gonna take time. So sometimes what nurses they do, they start the drug round at 1 o'clock if they have 12 patients. But if I have if I have 5 patients or 6 patients, I can give the drugs for 12 at the sharp 12, and then I'll give later at 2 o'clock as well, because we have drugs most of the time for 12 and 2 o'clock. So the two times. Sometimes if they have loads of patients, if they have 12 patients, they start maybe 12:30 and they will finish 1:45 or 2 o'clock. So it always depends. You need to prioritize your things, how you're gonna do it. So you would see in the morning, like if the drug round took you 2 hours, then you have to start maybe 12:30 or let's say 12 o'clock if it's gonna take you time, because in the medical wards, patients have loads of medicines, they have loads of 2 or 3 drug charts. So it depends. You would see in the morning drug round how long it took you to finish the drug round. So accordingly you're gonna prioritize your things. Now we have given the medication, lunches are done. Now it's your time for your break. Sometimes they take break around 11. If you have time after doing the washes, you can go for your break. If you don't eat breakfast at home, But for me, I like to take it around 12:30 or 1 o'clock, because I usually have breakfast at home, but I do lunch at work, so that's my lunch. I'll do it most of the times 12:30 or 1 o'clock. And after that, you have some time, if anything outstanding, if anything pending, or you have to do OBS which were due, or if someone is scoring high, you always need to check according to your EU score, if they need continuous monitoring, if they need you to do the OBS every 30 minutes or every 1 hour. So it's all according to the EU score, new score. Yeah, so after that, it's now we have taken our break, we are nice and fresh. Now you have time to do your notes. Yeah, you can write your notes now, you have time. And you can also, if you have if you are free, if you have finished your notes within time, you can go around, talk to your patients. Sometimes they need, most of the times they need your moral support, they need your time to talk to them, because I work in a medical department, elderly ward, so they need someone to talk to them. Yeah, so if your support worker is free, they can talk to them. If you're free, you have time, go sit with them, give them some time. Yeah, and now we have done our notes. Let's say it's around 4:30, so breaks start again. Some people, they like to take 4 o'clock, some people they like to take 4:30. So it's like half hour break in morning and half an hour in the evening, so whatever you like, you can do it. After taking the break for 30 minutes, let's say it's 5 o'clock, you do the blood sugars again, you do your OBS again, and 6 o'clock you do the drug round. So after doing the drug round, so for the long days, we do the drugs for 6 o'clock and 8 o'clock. Yeah, because if the night staff come, they won't be able to do the drugs right away. Yeah, they will do the drugs if there are for 9 o'clock or 10 o'clock, 10 or 9 p.m, but they won't do for 8 o'clock. But in certain departments like ITU, ICU, or acute medical unit, they do the night staff do the 8 o'clock drugs. But in the medical wards or surgical wards, we do the drugs for 6 p.m and 8 p.m before we finish our shift. So you need to check with your department. When you join any particular ward, they'll tell you all the routine, because you work as supernumerary for 14 days, so you would know what's the routine of that particular ward. Obviously, if it's a acute department, acute medical unit, or ITU, ICU, you cannot give the medicines, right? You cannot give the medicines which are due for 8 o'clock, you cannot give them at 7 o'clock. You can't. But also there are certain drugs like anti-epileptic drugs or Parkinson's medicines, you are not allowed to give any time before their prescribed time. If they are prescribed for 7 o'clock, you are gonna give at 7. Yeah, most of the time what I do, I put an alarm on my phone to remind me that I have a patient on Parkinson's medicine, so I should give this medicine exactly on time. So we are a medical ward, so we are allowed to give medicines for 6 p.m to 8 p.m. What we do, we start around 6:30, so I would finish my drug round around 7:30 or 7:45. 7:30 most of the time, because then after finishing the drug round, I also need to prepare the handover for the night shift. So this is the 12 hours routine. These are the things we do throughout the day. You have three or four drug round. If you have less patient, you have two drug round in the afternoon, 12 and 2. But if you have loads of patients, 12 patients, you have 3 drug rounds, and it takes time to finish the drug round. And by luck, if you have lots of patients for insulin, it's gonna take time. So you need to learn how to prioritize things, how to prioritize. I like to do is, before starting my drug round, I like to give insulin first, because that's the time the patient would get their breakfast also. So you can give insulin before starting their drug round. It will save you loads of time. that's just an extra tip. So give insulin before starting the drug round, because it's gonna save you loads of time. So this was the overview of a long day shift in the NHS. If you are a new nurse or planning to come to the UK, prepare yourself. Think about the routine. It's ongoing. You're not gonna sit even for 1 minute. It's but if you are in a department where you get like sick patient, ITU, ICU, or I would say acute medical unit where you get 3 or 4 patients, you would be lucky. But ITU has its own problems, its own complexity of the drugs, of the IV fluids or intake output. Yeah, but here I did not mention, even with our acute medical patients, there are patients who are on stool chart, there are patients who are on insulin, I said earlier, there are patients who are on what do you call it, intake and fluid and fluid chart, food and fluid chart, and fluid intake and output chart. So you need to remember there are patients who are on catheters. So make sure that you check your all patients before you start your shift. Make a little diary, take a little diary with you, start writing your notes, make a to-do list in the morning. It will save you loads of time. And then always remember, you need to prioritize the things you do. That would be the way for you to become a star of the world. Okay guys, so that's it for today. I hope you enjoyed the video. If you have any more questions, if you want me to make any other video about NHS nurses, what they do, how they do, if you want to know about any certain procedure or anything else, don't hesitate to ask me in the comment section. I would be more than happy to answer any queries. All right, thank you so much. Take care guys. I'll see you next time when I'm off. I'll make another video. Take care. Bye bye.